Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. Earlier this month, Dr. Shivani Verma joined us to mark American Heart Month with a wide-ranging conversation about heart health. In this month's Keynote, we asked Dr. Verma about broken heart syndrome, a rare but very real condition that can be serious, but that most people recover from in a few days or weeks. With Valentine's Day just a few days ago, we wanted to explore a little bit the idea about broken heart syndrome. Is there such a thing as a broken heart?
Yes, in a way. It can be fixed is the good thing about it. But it's what we call is actually a Takotsubo cardiomyopathy. It's specifically about the heart muscle just getting stunned after an emotional shock. So a broken heart. They've seen it in patients who've had loved ones that passed away, which is where I think the broken heart terminology came from. It's commonly in people who recently lost a spouse, a long-term spouse, but it can be due to any trauma, emotional stress, where it's not specifically known what exactly causes the muscle to decompensate, but it causes the mimicry of a big heart attack. So people feel very, very bad chest pain, almost like you're going to die. They come in and the EKGs look exactly like a massive heart attack.
Wow.
Then you do the procedure to look at the arteries and it's normal. And then when they do the pictures to see the function of the heart, there's a specific morphology, which is where part of the terminology comes from as well. But you can tell exactly what it is, and it is this broken heart syndrome. You can get it after a big stressor on the body. And if you've had it once, while you can take medications and bring the heart function back up, and sometimes after the whole stress on the body has resolved, it may come up a little bit on its own as well. It puts you at more risk of having it a second time because already you know that your heart muscle is vulnerable to trauma and stress.
For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.